Hi everybody, this is Venk with Always on EM. As you know, I'm in Vegas exploring the research forum. I bumped into Caitlin here and I'm really excited to learn more about her work. Caitlin, do you mind sharing with us who you are and a little bit about your science?
Sure. I'm Caitlin Ryus. I'm an assistant professor in emergency medicine at Yale, and I'm going to be discussing the relationship between housing status and treatment engagement for patients with substance use disorder in the emergency department. So, both individuals who are unhoused as well as those who have substance use disorder frequent the ED, and it's an important touch point for their care for that reason. In this study, what we were looking at was how the relationship between housing status and treatment enrollment for patients in a program that is an ED-based intervention for folks with substance use disorder. In this intervention, we have health promotion advocates, also known as HPAs, who get consulted when a patient who has substance use disorder presents to the ED. And what they do is they take a detailed history of the patient's drug use, they conduct a motivational interview, and then they refer them to treatment programs. And so in this analysis, we looked at a retrospective cross-sectional study of the data from this program from 2015 to 2023 and did a secondary analysis of how this relationship works when you take into account housing status. So housing status was identified using ICD-9 and ICD-10 codes depending on the year, chief complaint, address, registration screening questions, and other elements of the EHR to help us identify folks' housing status. We controlled for covariates of age, race, sex, and insurance type, which were all significantly different between the two groups, so those did allow us to have adjusted odds ratios. And our outcomes of interest were substance use diagnosis, readiness to change, which is scored on a scale from 1 to 10, 1 being not ready to change at all, and 10 being ready to engage right now.
Yeah.
And then type of referral, which is direct versus indirect, so like whether they got in a car and went to the treatment facility right away, or whether they were given information so that they could connect on their own. And then enrollment in treatment program at 30 days, like when we followed up, as well as repeat ED encounters with our HPAs within that 30-day follow-up period.
Okay.
We analyze this using binary logistic regression, adjusting for those covariates that I mentioned before. And so what our findings showed was that the folks who were unhoused compared to those who were housed were more likely to receive a diagnosis of alcohol use disorder. They were also more likely to receive a diagnosis of opioid use disorder. However, when looking at their readiness to change scores, there was no difference in how they scored themselves in terms of readiness to change for alcohol or drug use between the housed and unhoused cohorts.
Okay.
The folks who were unhoused were slightly less likely to get a direct referral. However, at 30-day follow-up, there was no difference between the two in terms of who enrolled. But what was different was that there was a 40% increase in likelihood of having had a repeat encounter in RED with the HPAs during that follow-up period. So what our findings suggest is that while patients who are unhoused may exhibit higher rates of substance use disorder, their motivation for change is comparable between housed and unhoused folks. But what we may be seeing is that folks who are unhoused encounter unique challenges that contribute to this ED revisit pattern. And so I think that for future directions, we need to combine housing support with substance use disorder treatment in order to find sort of sustainable solutions for this patient population.
That's excellent. I'm really glad that you're working on this, and especially targeting two separate factors that could make somebody a little bit less inclined to get the best care. Combining them, that's fantastic. So thank you so much for all you're doing, Caitlin, and your whole team. And I hope you have a great time here in Vegas. So Thanks for sharing it with us.
Thanks so much.